with us Trudy Sullivan, Health Catalyst. How are you, Trudy?
I'm doing great. How are you, Marsha?
I'm wonderful. We moved you in real quickly.
I loved that conversation, though. I didn't really want it to end. So thank you.
Well, you know what? We had to move her so we could get in to understand what Health Catalyst is doing. We didn't want to leave you all out because you all are doing some amazing things as well. And we want to hear about, first of all, I want to hear about you. How did you, I really like knowing and learning about the people that work in the companies that are partnering with us. And I'd like to understand how you even got into this industry and what created the gateway or the pipeline for you to do that.
Okay, so I have spent a lot of my career in healthcare and then in technology. So I was with the American Red Cross and then worked in semiconductors and aerospace and defense at Raytheon, which is where I got the opportunity to experience and see CCG at its finest. I still talk about BEA any chance that I get. And so when you put those things together, healthcare and technology, I found my way to the healthcare IT space, which is the sector that Health Catalyst is in. And so it's been really exciting. I've just been there for a year and a handful of months, and we took the company public just a year ago, July. So it's been a really great journey. And I found Gwen again, Bethia at CCG when we started looking at ways to grow our capabilities, connections, network on our diversity and inclusion journey. And here we are with Health Catalyst's inaugural experience at the Women of Color STEM conference, and it's been phenomenal.
Well, and so when you say phenomenal, we're in a whole new world. You've been to BEA, so you know what that looks like. You've probably been to Women of Color before in Detroit. And so now this whole virtual experience, how is that really working with your organization?
Well, I think it gave us a lot of opportunity to invite and include more people because you don't have the restrictions for travel, and an opportunity to allow people a little bit of flexibility around their work schedules to jump in. Like today, it's beautiful to be able to join on a Saturday but not have to travel to do it, and then to be able to pick and choose around meetings. So we were able to include more people from kind of all walks of Health Catalyst life. So we had some of our team member of color affinity group is called Shades. And we had we have a very egalitarian cohort of leaders for that affinity group, and several of them were able to join. And then one of our recruiters as well, just to get a feel for what this experience is like and what it offers and provides. So super excited for people to be able to see it and take advantage of the virtual experience, which I think you guys have created in wonderful ways. So it's been great. I loved the Leaders and Legends breakfast this morning and the Boeing discussion. I mean, I think it gives you the flexibility again to be comfortable, settle in, listen, and not have some of the distractions that go along with travel.
Normally, that's exactly right. And I really wonder if this is going to be the new normal because it works. It
does work really well. I know that you probably have more people that are able to attend, which is great. The numbers are up and people meet more people in a different way, but still the synergy and energy that comes from the relationships is so important.
It's huge. And, I think one of the things that in looking at your organization and being a new company, and doing new innovative things, what type of individuals are you looking for to be part of that team? Because you've created a whole different kind of mindset within what you're doing, right?
So Health Catalyst, we're a leading provider of data, analytics technology, and then service domain expertise to healthcare organizations. So we're committed to being the catalyst for massive transformation in healthcare. And there's so many opportunities. So we really are dependent upon STEM and the STEM field and STEM careers and leaders in STEM because, we're really putting together a cloud-based infrastructure that integrates data and allows us from the electronic health record or the electronic medical record through disparate sources of data about patients to be able to give hospitals a better chance of making good decisions, data-informed decisions to drive better outcomes. So that takes a mix of careers, but definitely people who have engineering and software backgrounds are a big part and play a big part in what we do to drive change. So, and then all the disciplines as well. We had a really interesting year, as everybody has, but have had 3 acquisitions since February, despite COVID. We brought a lot of new people into the Health Catalyst family. And at the same time, we were able to provide 9 different solutions that would help with COVID to our hospitals and hospital customers and payers. And so what we discovered along the way is what everyone else has struggled with, that COVID has been such a blessing and a curse. So the blessings have been from the realities that we've seen around the strength that data-informed decisions are allowing folks to make and the rapid recovery and improvements. So we did see, for example, the disparities in outcomes for Black and Hispanics early on, death rates, infection rates, much higher. Things are beginning to change with data, and we're optimistic about that. But we also are in the process of creating a health equity guidance solution that our customers can benefit from, so that moving forward, the data is there for you to overcome and prepare for and better navigate with the socioeconomic indicators of health as a guide, and better population health about your demographic that you serve. So lots of opportunities for people in all disciplines to help us and to help us grow and ultimately transform the outcome for hopefully every patient on the planet, because there's such room for improvement.
So that's a really good question. When you talk about managing that data, and how do you use that data when you're looking at communities that have been disenfranchised and lack the basic human services that most people can have? How do you take that? Who do you give that data to? Who are those customers, or the types of customers? You don't have to name them, but the types of industries or the types of organizations that would be able to take that data and turn it into what, right? Now that we know what happens, what do you supply, what do you provide, and how do you deploy, right?
Yeah, so we have a cloud-based data operating system, and really we partner with hospitals and healthcare systems predominantly, and payers, to take their data and give them better access to it and allow them to aggregate data cloud-based in one space. Super scalable, agile, flexible platform. And from that data comes analytics and applications and visualizations that allow people to see, oh, okay, this is what the data is showing and telling me. And from there, we have some of the world's most leading experts in different areas. Let's say we have a sepsis expert. We have, healthcare discipline experts across the board. They come in, and when you put the data, the apps and analytics and visualization capabilities and the service expertise together, that creates a really powerful picture and a capability for those leaders inside the organization, be it the chief information officer, the folks leading the analytics work, so analysts, financial teams, sometimes anyone that can help look at the data to drive clinical, financial, and operational outcomes. Okay. So depending upon sort of the size of the facility on occasion, or the journey that they find themselves in and their use of data, you could enter at a different point and have that opportunity for relationships change over the maturity of the relationship. But we, when we're working on clinical, financial, and operational improvements, it creates opportunities for dialogue with the CFO, for example, around driving costs down. There's just a lot of places and spaces where we connect, but primarily in the healthcare, health systems, hospital setting. Okay.
So that gives me a little bit more clarity. So then the next question becomes, you're here to also recruit, right? Your employees are here to learn and to be involved and to celebrate the accomplishments. But what else, as we are looking in this virtual environment, we have all these people that are coming, and you have a new company. Are you hiring, and what types of individuals are you looking for? What types of positions are you trying to fill?
So we are, managing the dynamics of COVID. So we're not hiring in large volumes today, but we expect that to change relatively soon. We're hopeful that by 2021, things look different. But we do have some opportunities that we're trying to build relationships with folks around. And one of those is the health equity guidance internship. So we're hoping to start to talk with folks about that internship opportunity where you could actually get in and dig into the kind of data that we were talking about to drive meaningful change and improve equity across the board in a hospital setting with us, our team, and key clients. So that is not big numbers, but that one internship is going to be a really, really important one for the organization, and starting to talk with folks and learn more about folks' interests and where the opportunities might lie. The good news is for us, we have customers all across the nation and actually outside of the US as well. But what we also are pretty good at, because we were doing it before COVID, is working remotely. And so that creates a lot of opportunities for our students and our early career professionals to think about us and not sometimes the challenges right now that come with actually physically having to move.
Mm-hmm. But I think the whole virtual gives us a lot of opportunity. The key, though, is as we deal with all this virtual, how we deal with the people who are still, and this is not a question for you, but it's just something that stays with me and has for a long time, is how do we still deal with the digital divide that is still happening in the world? And so I don't know what that answer is and how we deploy everything to everybody, but I just want us all to keep in mind that not everybody has access to the internet and to opportunities. So, I just think that's isn't relative to this, but some people won't be able to join us because they don't have that opportunity.
Yeah, I do think I think it's a relevant part of the discussion and an important thing to remember and think about. So technology, again, blessings and curses, right? Mm-hmm. When you have the access and you can use it, we're seeing that it does make dramatic change and has created a lot of good. But you're right, we need to find a balance so that we can actually make sure that we aren't creating issues or greater gaps than we've already seen with the new normal.
Mm-hmm. Well, that there are people who may very well be with you and every organization that's participating. So it's not just about Health Catalyst, right? This is a bigger conversation. And I was sitting here earlier today, just all of the corporations who've made this huge commitment to be here. And maybe one day we can all sit around and figure out how we do change that rural and urban disparity. But you all are doing a great job. I'm really excited about this new business and this new sector. I mean, I think that there are so many things that we're finding out about now, particularly in this COVID. People are doing a lot of research, and I think we were going to be coming up with a lot of new ideas and a lot of new processes to put in place. And it sounds like Health Catalyst. I love the name because it's a catalyst for change, right?
Yeah, we're excited. And like I said, we're just so grateful to be at this event. I think it's incredible. And I think the work that's been done to make it incredible, despite the challenges and I guess the opportunities that we've been talking about. I have so many friends who have benefited from the recognition that CCG provides. I loved listening to the Rear Admiral this morning, the 2020 Technologist of the Year, incredible. But also have, good friends and former colleagues, Crystal Jackson, Dr. Jeff Tate, others who've been recognized. And, we want to get to a place that we're a part of the recruiting and the celebratory efforts and the recognition that I think Women of Color STEM and Baya does so well. So we're happy to be here and part of the dialogue and allow people the chance to get to know us and see if there's a way that they can help us get better, because our ultimate vision is to really look like the patient populations that our clients serve, and that creates opportunity for everyone. So I think the pies continue to expand and the opportunities continue to grow, and I'm looking forward to being back here and seeing what 2021 will bring too.
And let me tell you something, your commitment and clearly your drive and the vision is really powerful. And I expect that we'll be reading a lot more about Health Catalysts along the way. And so we know that you are a leading provider of data and analytics and technology and services to healthcare. So keep up the good work, keep us posted on what you're doing, and we look forward to seeing you again next year and seeing you at Baya.
Okay, good. Thank you, Marsha. I enjoyed talking to you, and thanks
All
for
right.
all the good that you're doing. I love watching you and listening to the interviews, so thank you.
All right. Thank you as well. And good luck with your movement and all the things that you're doing. We really
Thank you,
appreciate you being
Marsha.
here. Take
Okay,
care.
take care. Bye-bye.
Bye. Oh gosh, I think I'm excited about that company. Brand new, really, and they're doing all kinds of innovation and creativeness. So keep them on your radar, ladies and gentlemen. You know, I think in time she's not doing a big hire right now, but it's coming, and they look like they're moving at warp speed. So let's make sure that you look up and stay in touch with their website, healthcatalyst.com.